Good morning and welcome to the Hawaii Health Data Warehouse Coffee Break monthly webinar series. I'm Tanya Lowry St. John with the Hawaii Health Data Warehouse, or HHDW, in the Office of Public Health Studies at the Thompson School of Social Work and Public Health at the University of Hawaii at Manoa. We're going to use the next 30 minutes to talk about the Pregnancy Risk Assessment and Monitoring System, or PRAMS, and how to find PRAMS data in our Hawaii Health Matters website, and how to build a report with PRAMS data in hhdw.org. PRAMS, the Pregnancy Risk Assessment and Monitoring System, is a surveillance project of the Centers for Disease Control and Prevention and state health departments. It was developed in 1987. PRAMS collects state-specific population-based data on maternal attitudes and experiences before, during, and shortly after pregnancy. It is the only surveillance system that provides data about pregnancy and the first few months after birth. The goal of PRAMS is to improve the health of mothers and infants by reducing adverse outcomes. Nationally, PRAMS surveillance covers about 83% of all U.S. births. PRAMS is a mixed method survey conducted at home by pen and paper or by telephone. Participants are selected by the CDC based on birth certificate information provided by the Department of Health. PRAMS follows a standardized data collection protocol, which includes a series of mailed letters and surveys delivered at specific intervals to mothers who have been selected. If these do not generate a response, then the DOH staff follows up with participants by telephone to complete the survey. The series of mailing starts about 2 to 4 months after delivery, and follow-ups by mail and telephone continue for about 60 to 95 days. Completed surveys are sent to the CDC for data processing and weighting, and unlike other surveys, PRAMS data is not all self-reported. It includes information that comes directly from the birth certificate. So, for example, breastfeeding information is reported by the mother, but infant birth weight and gestational age are taken from the birth certificate. The survey data are weighted to represent all residents who have given birth in Hawaii in a calendar year, and the data is available at both the state and county level. Roughly 1,500 people participate in Hawaii PRAMS each year, and HHDW has PRAMS data from 2000 to 2021 available for analysis. However, you will notice that there was a break in PRAMS data collection in Hawaii in 2017 and 2018, but thanks to some heavy lifting by the DOH staff, data collection resumed in 2019, which had a smaller sample size, but has been weighted to represent a full year of births. Today, we'll be demonstrating the 2021 data, and many thanks to Jane Awakuni, the state PRAMS coordinator, and her dedicated team from Family Health Services Division for all their work and tireless efforts to collect this valuable data for our state. PRAMS data can be accessed in both our Hawaii Health Matters websites, which has 34 PRAMS indicators, and in our hhdw.org site, where you can build your own custom PRAM report from over 170 PRAMS indicators. In HHDW, the data is grouped by categories, and here you can see the PRAMS categories. If you click on one of these white triangles, you can reveal the subcategories that are available. And then by clicking on the caret next to one of the subcategories, then you can reveal the health indicators. You can see here that the data is available at the state and county level, and you can find out more information about any of the indicators by hovering over the question mark, which will reveal the question used to create that indicator. And then you would click on state or county to create your default report. The Build a Custom PRAMS Report module in HHDW allows you to display or filter each indicator by response option, so it could be yes, no, or categorical, geography, years, mother's age, infant sex, mother's race ethnicity, and we have 3 ways of categorizing that: census, DOH, or program, and I'll show you where to find how we do that in a minute. Marital status, poverty level, we have 2 versions of poverty level in the system: infant gestational age and birth weight, and WIC use during pregnancy. So let's go to our homepage now and take a look at the data. We'll start here on the HHDW homepage, and I encourage you to go to hhdw.org and follow along. On our homepage, you'll see these prominent links to the Hawaii Health Matters site and the Build Your Own Report within the HHDW site. Scrolling down, you can get some background information about our site and some different tutorials that you can go through in the site to help you use the data. You can check out our news and announcements, and you can see that the 2021 PRAMS data is our most recent data set loaded. We have also information about our featured content on our Hawaii Health Matters site will be found here, and this is a great place to register for future coffee breaks. In this site, whenever you see this little orange square with the white arrow and you click on it, it helps you scroll back up to the top. So let's first take a look at the PRAMS data in our Hawaii Health Matters site. So you can go on and click here, and that will bring you to the Hawaii Health Matters site. And in this site, we have tutorials that are available here, which is a great place to start, but we're just going to quickly go through to show you how to access the data. We're going to go to Find Data and Community Dashboard. Again, we have another tutorial here for building custom dashboards and community dashboards. If you want more in-depth information, I refer you to this. We're going to click on Advanced Search, and we're going to do a quick filter by data sources, looking at the pregnancy risk assessment and monitoring. I'll just start typing it out. I can see the data source there, and then I can go ahead and click Search. And this will give me a quick report with all of the data that we have, a little dashboard for PRAMS in the Hawaii Health Matters system. So you can go and you can see that there's the name of the indicator, data for the state, data for the county. You can see that we have the point estimate, US values where it's available, comparison information, and so forth. We have a legend here on the side, which will help you look and interpret the icons that you see, but you can scroll down and you can see all the data that we have in the system here. Clicking on any one of these reports will bring you to some more information. In this system, it's whenever you see the little orange arrow will bring you back up to the top. If we wanted to go ahead and filter and look at this data, for example, only by the county of Hawaii, we could click there, hit search again, and then now we'll be seeing the same PRAMS data, but only that's going to be available for Hawaii County, and you will see this filtered dashboard here. I have created a dashboard for you that's the same thing, but filtered by state, but you could also just create that here. So it's just a quick way to look at the data that we have in Hawaii Health Matters. I'm going to go back over to our HHDW.org website. And then now to get to the PRAMS data, I can go ahead and click on Build Your Own Report and go directly to the PRAMS data here. By clicking here, will bring me to the PRAMS data collection page, or I can find out more about the PRAMS data with our data sources. If you're new to our site, and even if we've just loaded new data, I always recommend you go and take a quick look at the data sources page just to find out background information. So here for the PRAMS data, I'll click here. And again, we have those buttons that are going to be across the top. If I want to quickly go to Hawaii Health Matters or build my own report, these are always going to be here on the site. This will take you directly to the PRAMS report. We have a little background information about PRAMS. We have links to the national data site here, which is an excellent resource for all kinds of background information about PRAMS, how the survey is done, much more in-depth information. We have this table here that's going to give you the year that we collected the data, the number of people who were surveyed during that time period, and then also links to the actual survey instrument. So if you're kind of like, how did they ask that question? Was there a skip pattern and so forth? You definitely want to check out the survey instrument. And then we have links to our data release notes from each year. And I'll show you this on another page as well. Scrolling down on here, you'll see our report request. So if you've been trying to build your own report and it's just not quite working out, you need a little bit more help, you can submit a report request here. If you really want to get record level PRAMS data to do your own in-depth analysis, then you would submit a record level request. You go ahead and click on here and follow the instructions on that page. So coming back to the top, I'm going to come and build a custom PRAMS report. And this brings me to that PRAMS selection page, and I can go back to the source page. I can see the data release notes that we talked about briefly, and then I could also see a copy of this webinar. But I just want to show you quickly that PRAMS data release notes. So in 2021, the only real change is we've been moving across our system. We used to use the term Caucasian, which was the department's preferred term. We're now switching to white because that is actually what it says on the surveys and on the forms. And we use the term American Indian or Alaska Native. For some reason before it was Alaska Native or American Indian. These are more generic terms that are more well accepted across the system. So we've just changed that. For those of you who may be new to the PRAMS or were here last year, we did load 90 new PRAMS indicators in 2020. So if you want to go and see some of the newer data that we have, that's going to be in here as well. Scrolling down, you can see what we did on different years. And then here at the bottom, we have how we mapped the race ethnicity. So what it says from the source, how it will map into our program race, our DOH race, and our census race ethnicity categories, as well as the additional documentation for that, our geography, how we came up with the poverty level. We have Cuddlechuck Index, which is also in here as an option. So all of that information is going to be here on our data release notes. So it's a great thing to take a good look at. Going back here, I'm now in our indicator selection page. And as we mentioned, whenever you're going to click on one of these white arrows, it's going to reveal the subcategories. Clicking again will reveal the indicators themselves. So you can see these are the indicators we have about mother's health during pregnancy. Last year, one of the things that we added were some new information regarding mother's health during pregnancy. So let's take a look at eclampsia. Again, we can hover over here and we can see that this is based on people who answered during your most recent pregnancy. Did you have any of the following health conditions? High blood pressure that started during this pregnancy, eclampsia or preeclampsia. You can see then that we can also go ahead and select this based on state or county. So for this first one, we're going to go ahead and do it on county. And then you get our standard report, and our standard report is going to be the last 3 years of data. So if it's state, it'll be 1 year after the other. If it's county, they'll be grouped together so that we get a more stable estimate by county. We have our query criteria. So these are going to be women who had preeclampsia, eclampsia, or high blood pressure that started during the pregnancy. The data is by county. It's for these 3 years. And you can see here, you'll get a chart that will show you, then you can roll over to get the underlying data. It is also available here on our Excel table. One of the things that we always provide is the point estimate, the lower confidence interval, the upper confidence interval, the count, and that average annual estimated population. So to be reading this, you would say in Hawaii County, 14.5% of women reported having high blood pressure, eclampsia, or preeclampsia during their most recent pregnancy. And that's about 300 births per year out of an estimated 2,000 births per year in Hawaii County for during this time period. Scrolling down, you can also see that we have a map. These are standard within the system whenever we have a geography just standing alone. So you can see here, and you can also hover over the map to get the underlying point estimates. The maps and the charts can be just screenshotted to use, but we can download the data here in our export to Excel. Scrolling down then on our normal reports, you can also at this point, if you want to detour and go to a different data set or select a different topic, we have this option for you. We always have those technical notes, which will be the question wording, exactly how that was worded in the survey, information about the data. This data sources citation would be our recommended site, how you would cite this data. And then we have our issues in terms of how we calculate statistical stability throughout the system. And we have a standard way of reporting it because each of our different data sources have different reporting requirements and suppression requirements, and we'll get to that in one of the examples. So scrolling back up here to the top, again, the power in this system is going to be in that ability to modify the query. And so I'm going to go ahead and modify this query and say, this is what it looks like in the past 3 years combined. What if I want to look at all the years for which we have data? So I'm going to go ahead and hold down my Shift key and select all years. When I come here to the Query Builder page, the first 6 steps are going to be there for me to filter my query, and the last step will show me how I'm going to display it. So I can see here, for example, that this question was asked in this most recent phase of PRAMS and in the first phase of PRAMS, and it was not asked in between. But the power of the system is that you can look at them all together. And I'm going to go ahead and look at it by geography. And in this case, let's go ahead and keep it at the county level. Verify here that we're at county level. So I want to look at it by year and geography because I'm going to see if there's a trend over time. I also have the ability to look at use some different charting. So for this one, I'm going to go ahead and look at a line bar with errors, and I'm going to hit submit. When you are making these selections in your modified query, you're actually generating standard code, and this is running this on a live SAS data set that sits underneath. So these are infinitely configurable. So you can scroll down here and we can see this data over time, and we can see that, okay, this is what happened. This is a little bit busy, but I have the data table underneath, so I can kind of take a look and see if I see a difference. One of the tricks that you can use in the system is whenever you have these multiple colors down below, then they're actually selectable. So let's say I'm really interested in Hawaii County, and I can't really see it because there's a lot going on. So I can actually unclick the other counties here so I can really hone in on what I want to look at. So this is one way that you can use the system that can be helpful to you. So now let's say I want to go back and take a closer look at some of this data, and I want to say, okay, well, what does this look like for the state as a whole? Because it looks pretty changey over the county. So I can just actually remove the geography here, or I can go ahead and switch the geography to state and then go ahead and hit submit again. And then now I can see the data over time sort of in one line. And you can see that it's pretty much the same at around 13%. It went down and then it's gone up a little bit. So I want to see a couple more years. But again, I can take a look at these confidence intervals and see that they all sort of overlap. So there's not a statistical difference, but there may be, in this case, confidence interval one year or the other, but there may be an ongoing trend here. I can also go back and say, well, what if I'm really interested in saying, are there any particular high-risk groups? So let's say I'm going to go now and just look at the most recent years of data. So I'm going to change my query to this. And let's say I'm interested in saying, is there an age association here? So I can look at mother's age. And I'm going to change my chart to looking at being a vertical bar with labels. And I'm going to hit submit. So I'm looking for the data for the state for the 3 most recent years. I'm looking at the data by maternal age group. And it looks here that among people who are less than 20, it's 11.5% compared to more like 14.5% in the older age groups. But I can see here that the confidence interval is big. And scrolling down on here, I can see that there's a caution here that this estimate for under 20 is unstable. And we say that we want you to use caution because the relative standard error is greater than 0.3 3, and it may be unreliable. This is reportable data by PRAMS standards, but we would say that when you see a relative standard error like that, you probably want to aggregate more years of data. I can also go ahead and say, let me see if I can see a difference by race ethnicity. So quickly go through and change this to look at race ethnicity, and I can hit submit. Again, I'm looking at 3 years of data, so it should be relatively stable. I might look at this and go, I'm not really sure. I'm having to do a lot of work here. One of the other tricks that you can use with the system is that you can go ahead and sort. Whenever you see this ellipsis here, you can go ahead and sort ascending or descending. You can do some filtering here as well, but I can go ahead and sort it here. It will sort it in my table and also in my chart, so I can see it's lowest among other Pacific Islanders at 12% and highest among Filipinos at 17.5. And again, if I want to know if there's statistically difference, I can go back and take a look, and I can see that they overlap, but that gives me, so they're not statistically different, but that can give me some more information. Also here, I'll notice that several of these estimates are unstable, so those are things that I would want to be careful about reporting out to understand. So I want to show you just one more thing when you're looking at a categorical variable. So I'm going to select a new indicator, and I'm going to come here to health insurance coverage. And I want to look here whenever I see that it says CAT on it. This is a categorical variable, and our categorical variables, we allow you to look at 2 ways. You can look at them all together or just pick one of those standard options. So we'll take a look at current health insurance, and then for the last 3 years, and you can see that the options were private insurance, self-pay, Medicaid, TRICARE, and other. So let's say I'm particularly interested in Medicaid. I can go ahead and unclick and look at the data this way to be able to see it. But if I want to do more analysis on the Medicaid data, I would come back here and selecting the indicator, health insurance coverage, and I would choose one category, current health insurance. The default report will be the first of private insurance. I could come back over here into the modify my query and pick Medicaid Quest data. And let's say I'm interested in who've used that by year, and I can go ahead and select all the years and run a report, and to see maybe if there's been differences over time. And then I can take a look and see, well, it's been pretty stable. Looks like it was going up. It's kind of down again. So there's probably not really a trend there, but I can get overall information. And I can go back and slice and dice that even more by age group and so on and so forth. So let's come back here and work on your activity. My questions for you is using the data from PRAMS in 2021, what percentage of women were asked about drug use during one of their prenatal care visits? So that's going to be during pregnancy. And then if you could take a look at that for 3 years of data, look at it by county, age, DOH, race, ethnicity, and poverty level. My next question is, what percentage of women used marijuana during their pregnancy? What percentage smoked e-cigarettes during their last 3 months of pregnancy? And what kind of infant sleep data are available in PRAMS? So the first question was, what percentage of women were asked about drug use during one of their prenatal care visits? So I'm going to come back here so I can do select a new indicator, or also there's breadcrumbs up here and come to measure selection. And so this is going to be during pregnancy, prenatal care, is a little hint there. And you can see we have a lot of questions in here, but we have ask about drug use. So again, this is how the question was asked in there. So we're going to hit select here. This is going to be our standard report. So in 2021, it was 84.4% were asked about drug use during their prenatal care visit. That's the lower and the upper confidence interval. So out of about 14,600 births, 12,400 women were asked about drug use during pregnancy. So let's examine this data just to get a little more information by county first. And going here, we're going to switch our geographic area to county. We're going to stick with those 3 years of data. So we're going to just aggregate them up together. So I'm just going to switch over here to geography and hit submit. And then you can see here is the data by county. And it ranges from, I'm going to go ahead and just sort it real fast. It ranges from 82.9% in Honolulu County to 89.8% in Hawaii County. And again, we have a map for that. The next question was to look at it by age. So I'm just going to come up here, modify my query, and I'm going to go ahead and just change it to mother's age group and hit submit. And you can see that it was highest among women who are less than 20. 93.8% of them recall being asked about drug use during pregnancy, compared to only 79.5% of women who are 35 and older. And you can see here that these guys, the confidence intervals, the overlaps was not statistically different, but it looks pretty close. You might add more years of data and see if that's the case. And then we can do the same thing and run it by race, ethnicity, So same thing here. We could do race ethnicity. We'll go ahead and use DOH race ethnicity. And we can see that there are differences. This is the by race ethnicity. I'm going to go ahead and just sort it again. For me, it's a lot easier for my brain to see it that way. So it's lowest among Chinese at 72.9% and highest among other Pacific Islanders at 93.1% in terms of being asked. And again, you can see that these confidence intervals, this one here and this one here, do not overlap. So other Pacific Islanders are statistically more likely, same with Native Hawaiians, to be asked about drug use during pregnancy compared to Chinese and Japanese counterparts. And then we can also look at that data by poverty level. And again, we have two ways to look at poverty level in the system. We have a 2 level and a 3 level. So you'll see them here. And if you're like, what does it exactly look like? You can come up here and take a look at by this other demographics, and that will show you our poverty 2 level and our poverty 3 level. I'm just going to go ahead and do it by 3 level just to be the most granular. And click here. And then you can see that it's going to range from amongst the people with the lowest poverty level, or most likely 90.1%, compared to, and the 186 plus was 80.9% in terms of who's being asked about drug use during pregnancy. So there are some differences there. The next question was, what percentage of women used marijuana during their pregnancy? So I'm going to come back up to select a new indicator. And so it's going to be during pregnancy, alcohol, tobacco, and other drug use. And you can see there's a variety of questions that have been asked. We're going to look here at marijuana during pregnancy. And so they were asked is, did you use marijuana or hash in any form during your most recent pregnancy? And the answer to that in 2021 is going to be 3.1%. And we see it over time, but you can also look down here. This is going to be the average in the last 3 years. So it'd be 3.4% report using marijuana during their pregnancy. And the next question is going to be about e-cigarette use in the past 3 months. So we come up here, we'll see it here as well. And again, you can see there's quite a bit of variation by year. So you might want to think about using the 3 year together. And you can see these two are unstable. So probably I would use the 3 years together and say that from 2019 to 2021, about 1.2% of women reported smoking e-cigarettes during their last 3 months of pregnancy. And the last question is, what kinds of sleep data is available, infant sleep data in PRAMS? And you can see that we have infant's health here, and we have data that goes from the positioning of the baby to where the baby sleeps, any kind of advice that they had received, and where and how baby sleeps. So those are some of the answers to our questions there. We'll be resuming our normal coffee break schedule, which is the first Tuesday of every month on August 1st at 11 a.m. And we're going to be covering how to do a record level data request in HHDW to ask the Department of Health to be able to get record level data. And also to give you a preview looking in September, coffee break will be on our expanded HP 2030 data tracker.